The power to master your diabetes with just a few simple tools: insulin pens and pumps. Today we're diving into Insulin 101, where you'll learn everything from the types of insulin to pro tips on injections and using modern devices. Ready to take control? Let's jump in. At its core, insulin is a life-sustaining hormone that helps your body convert sugar into energy. Without it, blood sugar levels can skyrocket, leading to serious complications. Understanding how insulin works is your first step toward managing diabetes with confidence. There isn't just one kind of insulin. There are several, each designed for different needs. Rapid-acting insulin kicks in quickly for mealtime spikes. Short-acting covers the immediate post-meal period, while intermediate and long-acting insulins provide a steady baseline throughout the day. Knowing these differences helps you tailor your treatment perfectly. Diabetes management isn't one-size-fits-all. Consider your daily routine, meal timing, and activity levels when discussing options with your healthcare provider. With the right mix, you can optimize your blood sugar control and enjoy more energy throughout your day. Let's talk injections. The right technique is crucial. Always clean your injection site, rotate your spots to prevent skin irritation, and never rush the process. A steady hand and proper preparation can make a huge difference in how well your body absorbs insulin. Before you inject, gather all your supplies, whether you're using a syringe or an insulin pen, and ensure they're in pristine condition. Check expiration dates and keep your workspace sanitized. A calm, organized setup not only reduces anxiety but also leads to a smoother injection experience. Enter the insulin pen, a compact, user-friendly tool that many prefer for its ease and accuracy. Pens simplify dosing and are perfect for those on the go. Plus, their design often makes it easier to remember your routine, keeping your diabetes management on track. Using an insulin pen is all about precision. First, prime the pen to remove any air bubbles. Then, dial in your prescribed dose. With a steady hand, press the injection button firmly and hold it for a few seconds to ensure the dose is fully administered. Practice these steps until you feel confident. Consistency is key. For those looking for even more flexibility, insulin pumps can be a game changer. These devices deliver a continuous supply of insulin, mimicking the natural rhythm of your body. Pumps are especially useful for managing fluctuating blood sugar levels throughout the day and night. Getting started with an insulin pump can seem daunting, but it's all about familiarizing yourself with its settings. Learn how to adjust basal rates, set up bolus doses for meals, and troubleshoot common alerts. Always keep a log of your pump settings and any changes, and don't hesitate to consult your healthcare provider for personalized advice. In just a few minutes, you've unlocked the essentials of insulin management, from understanding types and mastering injections to navigating pens and pumps. Remember, your journey with diabetes is unique, and the right tools and techniques can empower you to live a healthier, more balanced life. If you found these tips helpful, subscribe for more expert advice and share your thoughts in the comments below. Here's to taking charge of your health, one smart decision at a time.